And we see the.
All right, can everyone see that?
Yes.
Okay. Well, thank you for inviting me to speak today, and I'm going to share a little bit about the NIH overall, the history and mission, a focus on my institute, the NICHD, and our priorities in pediatric trauma research, injury prevention research, and then funding opportunities and priorities. A lot of what my colleague just shared for AHRQ is very similar to that. So I'll focus a little bit more on the priorities, and hopefully there will be time for questions afterwards. So many of you know the NIH. It is the nation's medical research agency with a goal toward improving health and saving lives, fostering medical discovery, and building scientific leadership. And I love this aspect of our mission because we want to ensure that we're getting more investigators into the pipeline of answering compelling questions about seemingly intractable public health issues that affect our population. And so this is at the core of our mission, to build that workforce and build scientific leadership. So we want to seek fundamental knowledge about the nature and behavior of living systems, as well as the application of that knowledge to enhance life and lengthen life and reduce illness and disability. Our goals are to foster fundamental creative discoveries and their applications to improving health, to develop, maintain, and renew scientific resources, and to build our capacity to prevent disease. So some of our funding mechanisms are not only for conducting research, but for infrastructure as well. We want to ensure a continued high return on the public investment in research. So having rigor and reproducibility are priority areas in the review. And we want to exemplify and promote the highest level of scientific integrity so that we can maintain the public's trust in the science that we put forward and invest in. So just briefly, I'm sorry, I'm a frustrated historian, so I always share a little bit about the history. It started as an intramural, if you will, a one-room laboratory on Staten Island, created within the Marine Hospital Service as a predecessor to the Public Health Service, and it evolved into the Hygienic Lab, which moved to DC in 1891, and with the Ransdell Act of 1930, became the National Institute, singular, of Health. But this is what started the focus on public funding for medical research. And here's just a snapshot of Senator Ransdell and the act that got this work started. So at NIH, we have an intramural division in all of the institutes, as well as extramural, where we issue funds out to you, the community, to do research and to answer compelling questions. And this act was the impetus for that. So now NIH is not a one-room laboratory, but we have 27 institutes and centers that make up the National Institutes, now plural, of health. And the NIH Clinical Center is the nation's largest hospital dedicated to supporting the health of our nation. And you can see this graphic of the 27 institutes and centers. Most of them are disease specific. So we have the Eye Institute, the Aging Institute, Cancer Institute, and so on and so forth. So I'm going to be sharing a little bit about the NICHD, where I reside, which has a broader mission. This was established by President John F. Kennedy in 1962, and you can see that he said that for the first time, we'll have an institute to promote studies directed at the entire life process, rather than towards specific diseases or illnesses. So why is this important? Why am I sharing this with you? Because what's critical here is that we have a broad mission at NICHD, and that we are interested not only in children, but we're interested in how these diseases unfold in children and populations and families across the life course. And you can see here the signing of the legislation to establish the NICHD, Eunice Kennedy Shriver, after whom our institute is named, handing her brother the pen to sign that legislation. And that's important because we were renamed the Eunice Kennedy Shriver NICHD in 2007 by an act of Congress. And this legislation was led by the late Senator Kennedy. And this, of course, was in honor of her vision and dedication for the work of the Institute. So our Institute, as I mentioned, our mission is broad. We want to lead research and training to understand human development, improve reproductive health, enhance the lives of children, and optimize abilities for all. Our vision is healthy pregnancies, healthy children, and healthy and optimal lives. So our strategic plan is organized around theme. Just want to lift up theme 4, which has specific scientific opportunities for trauma research, where we say that we will lead efforts to improve the transition of adolescents to healthcare providers, especially for those with chronic conditions, illnesses, disabilities, or childhood exposure, such as exposure to trauma or violence. Some of the scientific opportunities include focusing on the leading causes of trauma and injury in children and adolescents, and developing critical care and rehabilitation pathways to optimize recovery for children who experience critical illness or traumatic injury. With respect to health disparities, we know that pervasive disparities exist in the health of racial and ethnic groups, low resource communities, sexual and gender minorities, and underrepresented populations. And so these factors are important as we look at maternal health, birth outcomes, exposure to violence, various sorts of experiences that may occur in the life of an individual throughout the span of their lives. So in 2012, the NICHD established the Pediatric Trauma and Critical Illness Branch to reduce all forms and aspects of childhood injury and trauma, so that we could focus on improving the health and well-being of children and families. And our goal at that time was to focus on treatments for children and to invest in research that would look at ways in which we could design and fund the best therapeutics for children, some of those which were intended for adults. So we want to support this research and training and to build the workforce in that regard. So our mission is through transformative research, education and training and collaboration to prevent and reduce all forms of childhood trauma, injury, and critical illness to enhance healthy outcomes across the continuum of care. So again, we want to understand the injured child and support research that really underscore that. I'm not going to read all of this in the interest of time, but we want to foster broader understandings of the injured and critically ill child. And that includes not only the child itself, but all of the factors that promote child well-being. We want to look at the child in the context of its family and its community and society. And so we've identified research needs and gaps that we're hoping that you, the extramural community, will submit research grant applications to help us to better understand the unmet needs of the injured child. So right now, our branch is organized into 2 big programs, a trauma program and a critical care program. And I'll just briefly run through these as we'll have time for questions shortly. Research and training on the epidemiology of unintentional traumatic injuries in children, as well as the prevention and treatment of these injuries. We want to advance the science on the diagnosis, treatment, and prevention of all forms of child maltreatment. And you can see those here. We want to encourage studies on psychological trauma and the emotional processes that co-occur with physical trauma and that affect treatment, recovery, and well-being. We want to increase understandings of the effects of disasters on children and develop responses and preparedness to prevent trauma from these incidents. So we support research both domestically and globally toward that end. In terms of our critical care program, I'll just briefly share that, again, our goal is to develop a better understanding of the causes and disease processes of critical illness in children and life-threatening injury. We want to support research and training toward that end, looking at the etiology and pathophysiology of critical illness and life-threatening injury. We also want to focus on understanding the physical and psychosocial effects of critical illness in children and their families. So you'll see work here that we support in terms of end-of-life care, bereavement, palliative care. And then again, developing therapeutics and technologies and devices that will help us to advance the science of effective treatment for this population. And as I mentioned before, building the research pipeline, building the workforce to answer these compelling questions. So here are some of our funding opportunity announcements that are active, that we encourage you to respond to. We have a notice of special interest on COVID-19 pandemic and risk for abuse and injury among vulnerable children and youth. And we can see here that some of the questions that we're interested in is the extent to which disparities in child abuse identification screening can be deepened or become more pronounced as a result of this and this pandemic, and of course, other kinds of public health issues that may come down the pike in the future. We have a notice of research opportunity looking at the impact of childhood sexual abuse on gynecologic health and disease. Our theory here is that we might be able to understand disparities in reproductive health, gynecologic health, and disease, perhaps by looking at the extent to which there might have been a trauma history and what impact that might have toward those outcomes. We have a special notice on drowning prevention and looking at disparities in drowning and how we can prevent this leading cause of injury and death in children between the ages of 1 and 4. I want to spend a little bit of time and let me know how much time I have, but violence, our portfolio on violence is a very high priority for us right now. And of course, as you know, preventing gun violence is a leading cause of death. Gun violence is a leading cause of death, and we want to support research to prevent gun violence. These statistics, you all know, this is an urgent public health crisis. And what we've done is work not only at our institute at NICHD, but across the NIH, because we recognize the need for a coordinated program of violence research, including firearms, to address this compelling public health problem. So it's not enough that one institute or two institutes might have funding opportunities, but we wanted a coordinated program of research toward this end. We received congressional appropriations at NICHD to support this research, to look at the underlying causes and evidence-based methods of prevention of injury, including crime prevention. And so we've been very busy over the last couple of years since we received this appropriation to support research that takes on a broad public health approach, that looks at the various types of violence and populations affected, and that looks at the different types of research that would help us to address this issue. So one project that really reflects this coordinated effort is our network focused on community-level interventions for firearm and related violence and injury and mortality prevention. This has the goal of this was to bring sites together to form this network of projects that would address the violence at the community level, and therefore we required that community partners would be brought in as key personnel, not ancillary to these networks. You can see that we have a number of NIH institutes that are involved in this center, in this network. And right now we have a coordinating center at Michigan. University of Chicago is one of the sites focused on the medical legal partnership. George Washington University in Washington, D.C. is focused on changing the narrative in firearm violence. And the University of Mississippi Medical Center is proposing to establish a violence and injury prevention program. And so we hope to continue to build this network by adding sites. We have another funding opportunity that's still active, whose goal is to highlight interest in addressing the role of violence in health outcomes and in integrating violence-related screening and interventions in healthcare settings. This is still active, and the expiration date is October 2025. Our firearm injury and mortality prevention research funding opportunity, again, looking to highlight our interest in improving the understanding of identification of for pilot projects and looking at various types of approaches to improve the implementation of interventions. This is active until February 2026. And then finally, we have a youth violence intervention that's hot off the press from our National Institute of Minority Health and Health Disparities. And this is RFA, so there's a set aside of funding and there's a single submission date for this initiative, which is October 2nd. So I would encourage you to look this up on the NIH website if you're interested in building a team to respond to this funding opportunity announcement. I'm going to skip this one for the time being. The point that I want to drive home is that while I shared with you funding opportunity announcements that we're calling for specific research, that you are welcome to submit investigator-initiated applications using the standard funding opportunities, some of which my colleague from AHRQ mentioned and elaborated on, so I won't go into those details. But we have standard submission cycle for 3 times per year, where you can submit those applications on a topic of your choosing. Again, the R01, the R03, the R21. One thing I want to say before I end is that we also offer supplements, diversity supplements to grantees who have NIH awards with at least 2 years of funding left to promote the development of health-related workforce. So you can see the various career stages for these diversity supplements. And if you have time on your grant, you can apply and request a supplement. These are reviewed administratively. These are not peer-reviewed to get additional funding to help build the careers of someone who might be interested in an independent research career. We have a cycle for receipt dates and notifications for these supplements. As I mentioned, these are administratively reviewed. So there's a good chance that if you make a compelling case that you would be able to be awarded one of these supplements. Again, as my colleague shared, our Office of Extramural Research is where you can go to find funding opportunities, to sign up for listservs so that you can get information about research that or funding opportunities that are coming online and that have been published. So we encourage you to do that. And one of the things that I want to say is that our vision for the future is to eliminate all forms and aspects of childhood trauma, injury, and critical illness. And in doing so, improve the health and well-being of all children, families, and society. And that's why we invest in research. That's why we're investing in the workforce. And that's why we have the priorities that we have. And we encourage you to contact me if you have questions more about our work. I'm happy to answer any questions that you might have. And I thank you for your time and attention.